Hi, my name is Rachel Miss Livy, and I'm here to talk to you today about making the connections between climate change and public health in Kansas. The Climate and Energy Project seeks to dramatically reduce greenhouse gas emissions in America's heartland through the ambitious deployment of energy efficiency and renewable energy in policy and practice. In recent years, our work has expanded to include addressing the public health impacts of climate change and ways to build community resilience in Kansas. The connections between climate change and public health are coming to the forefront as many public health organizations are speaking out about climate change. This slide from the Centers for Disease Control, the CDC, illustrates the most significant climate change impacts, their effect on exposures, and the subsequent health outcomes. For example, increasing CO2 levels leads to increased air pollution, which leads to asthma and cardiovascular disease. The CDC explains that some existing health threats will intensify while new health threats will emerge. Not everyone is equally at risk. Important considerations include age, economic resources, and location. Some of our most trusted public health organizations are taking strong positions on climate change. These organizations, along with the American Public Health Association and many others, came together to urge action on climate change as a public health emergency. In 2016, these organizations released a declaration on climate change and health that was updated in 2019. So if you're curious what the Asthma and Allergy Foundation of America, for instance, says about climate change, you can read all about it on their website. In July of 2019, the Kansas Health Institute released a policy brief on health and climate change in Kansas, urging that climate change is a substantial concern in Kansas, particularly considering our agricultural industry. The report addresses specific concerns that will affect Kansans. Inspired by public health calls for action on climate change as a public health issue and informed by the Kansas Health Institute's report, the Climate and Energy Project, along with many other Kansas organizations, came together to release the Kansas Climate and Health Declaration in 2019. The Kansas Climate and Health Declaration aims to increase awareness of the impacts of climate change on public health, to increase civic engagement on climate action, and to advance policies that build resilience in Kansas. You can read the declaration and access many other resources online at resilientkansas.org. As briefly mentioned earlier, the Kansas Climate and Health Declaration pulls data from most recent scientific and public health reports. We relied on sources that provided either regional or Kansas-specific data, or that focused on specific health risks that will impact Kansans. You can access all of the resources at resilientkansas.org. For some context, temperatures in Kansas have risen about 2 degrees Fahrenheit since the beginning of the 20th century. Those temperatures are indicated by the orange line on this chart by the National Oceanic and Atmospheric Administration. This chart shows two projections for temperature change in Kansas under two scenarios: lower emissions in green, higher emissions in red. Under the lower emissions scenario, the coldest years would be about 2 degrees warmer than the long-term average. The higher emissions scenario projects that our hottest years will be about 11 degrees warmer than the hottest year in the historical record. And now let's dig into the details a bit. Climate disruption impacts the lives, health, and economic well-being of Kansans. We face increased risks of extreme drought, wildfires, floods, and food shortages. Increases in extreme weather threaten livelihoods, destabilize communities, and drain resources. We're already seeing these impacts. Farmers, ranchers, construction workers, first responders, and military personnel will be among the first to experience the effects of climate change. It's clear that climate change is a major public health concern in Kansas. We're already experiencing longer periods of pollen production, which will continue to worsen asthma symptoms and lead to longer and more intense allergy seasons. As we experience warmer temperatures, the changes in the geographic ranges of ticks and mosquitoes will increase vector-borne diseases such as Lyme disease and West Nile virus. As our annual average temperatures increase, we will experience increased heat wave intensity and frequency, increased humidity, degraded air quality, and reduced water quality, all of which will increase public health risks. Kansans will experience increases in cardiovascular diseases, respiratory diseases, and other chronic conditions. Impacts on mental health include increased stress, depression, and anxiety, strained social and community relationships, increases in aggression, violence, and crime, and increases in trauma, shock, and post-traumatic stress disorder. Those least responsible will be the most impacted and least able to adapt. The American Public Health Association explains that climate change exacerbates existing health and social inequities. Vulnerable populations will bear the greatest burden. Climate change affects everyone, but some more than others. Children, seniors, low-income communities, communities of color, immigrant communities, those with chronic disease, pregnant women, Indigenous peoples, and people with disabilities will be the most impacted. Fortunately, solutions exist at all levels to build resilience, economic opportunities, and healthy communities. Our first step is to protect Kansas water, energy, air, and land by preserving and restoring native ecosystems, supporting local food systems, and protecting our wetlands, rivers, and streams. More Kansas farmers and ranchers are protecting soil health, which improves water quality and quantity, air quality, and reduces the need for high energy and water-intensive practices while also sequestering carbon. We need to reduce emissions from electricity generation, transportation, and agriculture. Kansas leads the country with nearly 40% of our electricity from wind, which leads to reduced emissions. Kansas has as much potential for solar as we do for wind power, and we're just beginning to see how utility-scale solar, community solar, and rooftop or individual solar can help communities create their own clean energy. As much as we talk about renewable energy, our first step should always be affordable, energy-efficient housing, which provides more protection from weather extremes and saves energy and money while reducing emissions. As electricity rates continue to go up, we need access to programs that help Kansans save energy. Many states are adopting low emissions fuel standards to help reduce emissions and drive the electric vehicles market. Expansion of energy efficiency and alternative fuel programs help play a huge role in improving the lives of Kansans by building a strong local economy, reducing emissions, and reducing health-related impacts of climate change. To face the climate and health impacts, it is imperative that we secure and increase access to health care for Kansans across the state. This map reflects health outcomes across Kansas with darker colors reflecting worse performance. We invite you to take time to learn about the solutions that work in Kansas by watching this and other videos on making the connection and climate concerns in Kansas. If you need help, you can invite the Climate and Energy Project or any of the other organizations doing these videos to come to your community, to your organization, to your civic group, and give presentations about the issues that matter to Kansans. You can take action in your homes, organizations, and communities. You can engage in climate action efforts and get involved in the solutions we've outlined today. You can encourage your local and state officials to adopt state and local climate action plans to set a deliberate course for our future. Talk with your legislators about climate change. They represent you and your community. Attend days of advocacy at the Capitol, like Kansas Wealth Day, which happens every spring. More and more organizations are taking a stand on climate change as a public health concern in Kansas. If you have a particular health concern, like asthma, for example, or respiratory issues, think about what organization addresses those issues at the national or state level, and then reach out to them and see what their stance is on those issues and how they relate to climate change. For example, if you have asthma, you can look at the American Lung Association's website and see their statements on how climate change impacts lung health. If you are concerned about these issues and have a health concern, and you go to the website that represents that particular health concern, and they don't have anything about the impacts of climate change on health, reach out to them and ask what you could do to help them make those connections. You can also visit resilientkansas.org to learn about organizations in Kansas that are taking a stand and educating the public on the impacts of climate change and public health. There are many great resources on resilientkansas.org, including several of these videos making the connections between climate change and pressing concerns, like climate change and water or climate change and wind energy. And we really encourage you to do what you can to learn about these topics through the resources that are available on resilientkansas.org. If you want to know what actions your city is taking, check their websites, Connect with your local elected officials to see how they're addressing climate change. If they're not already addressing climate change, ask what you can do to help them make this a priority. To stay informed on climate action in Kansas, visit resilientkansas.org or climateandenergy.org. And also, a simple thing you can do is pay attention to the weather. Look at the changes in your environment and try to be curious about what's happening. Ask what's different and what's the same. And then try to see if you can make the connections between what you're experiencing and climate change through the resources we've listed today or through other resources available at your local public library or online. Talk to your neighbors, make connections with others who care about these issues, and keep learning. Our climate is changing in Kansas. We're already seeing these impacts. Get informed and learn what you can do to build resilience and safeguard the future of our state.